Hello, good day everyone. Assalamu alaikum and very warm welcome to our participants for this Sesame webinar. Thank you so much for taking time to join us today. I'm Dr. Shazia Iqbal. As a chair of Saudi Society for Medical Education, I'm very much pleased to welcome you all. As you know that our society is always very much keen to enhance knowledge in various fields of medical education, and today's session is a testament to this commitment. And we will discuss very important and timely topic, integrating social determinants of health into medical curriculum. This webinar will provide you an invaluable opportunity for identifying key social determinants of health and exploring how these can be integrated in patient assessment, leading to more comprehensive and holistic care. Moreover, we shall dive into how addressing these determinants in clinical practice can promote health equity and critical issues in healthcare today. I'm very much delighted to introduce our eminent speaker, Professor Dr. Muhammad Taha, who will guide us through this important discussion. Very warm welcome, Dr. Taha. Dr. Muhammad
مرحبا.
Hassan Taha is Director of Medical Education Center at University of Sharjah, UAE. His background is in medicine and he is master's and PhD in medical education from University of Jazeera, Sudan. He is fellow of Academy of Medical Educators in the UK and fellow of International Association of Medical Education, AMI. Dr. Muhammad Hassan Taha is a distinguished leader in medical education with focus on social accountability, integrating education with community needs and health systems. He serves as an assistant professor of medical education at College of Medicine, University of Sharjah, and is director of medical education center there and is coordinator for MSc in leadership in health professional education. He has lot of contributions to and publications in medical education, especially addressing leadership in social accountability. And I'm sure that this discussion will be very much healthy and we are looking forward to engage you. Thank you so much again for joining us for this webinar, and thank you, Dr. Taha, for joining us today. So without any ado, I will hand over this session to you. Questions will be taken by end of this webinar, and I shall be keeping eyes on Q&A section, and recording of this session will be available for you who has registered. Thank you. Over to you, Dr. Taha.
Thank you so much, Dr. Shazia Iqbal, for inviting me to deliver this session and to share with you uh, some thoughts about this important topic. And thank you so much to the Saudi Medical Education Society for providing us with a good opportunity to learn from each other and to share the expertise of each other across the region. Today we are going to share important thoughts regarding important topic, integrating social determinant of health into medical curriculum. And these webinars will address the following area, and this will be the outline. We will start by defining the social determinant of health and its importance in healthcare and health professional education. Then we will move to the framework for integrating social determinant of health and the appropriate teaching and learning approaches and methods. We'll explore international experience about best practices through analyzing case studies of social determinant of health integrations. And finally, we will end the webinars with outlining step-by-step guide to implementing an social determinant of health curriculum in institutes. And we'd like to listen to the experience of the all people joining us in these webinars and how we can advance the healthcare and the patient service through this important topic as we will discuss today, inshallah. So let us start together by defining the social determinant of health. The World Health Organization defines social determinant of health in the conditions in which people are born, grow, work, live, and age and the wider set of forces and systems shaping the conditions of daily life. And actually, social determinants of health are non-medical factors that influence the health outcomes. And as you know, the health is not only the absence of disease, there are several factors that can affect our health, as you can see in the left side of the screen, such as education, economic stability, neighborhood, built environment, healthcare, and social community context. So all these are the social determinant of health. And and the social determinant of health, according to the WHO, there are numerous studies suggest that social determinant of health account for between 30 to 55% of health outcomes. And also, data from the WHO estimates that the contribution of sectors out of health to population health outcomes exceed the contribution from the health sector. This, as can be seen here in this screen, all these factors together lead to have an impact on the health outcomes. And these outcomes, including the mortality, the morbidity, the life expectancy, the healthcare expenditure, health status, and the functional limitations. And addressing social determinant of health in medical education is very important because it is a primary strategy for attaining health equity, and it is fundamental for improving health, reducing long-standing inequality in health, which require action by all stakeholders and civil society. And this will lead us to think about how we can improve the medical education practice so that we can break the barriers between the education system and the health system and serving the community. And then let us go together to this important question. Why it is important to talk about social determinant of health now? Why are people now start to talk about these important issues, including the social determinant of health, including the One Health concept, and so on? As you know, a lot of research and practice identified gaps that in the development of the curricula across the last century, and most of the medical schools still now they are adopting the classical curriculum, which are predominantly focused on the biomedical basis of the diseases. And as you know, the societal shift necessitates curricular change. Now, in the recent year, there are many change in the practice of medicine. There are many change on the societal requirement, and the expectations of the community now change from before. Even the learner style and the generations now is different than before. And when it comes to reality check, there is a rising health disparity despite medical advancement. If you look at the practice of medicine and the medical education, you will find that there is a good advancement in the technology, there is a good advancement in AI and these important issues, which could not be neglected by any means. On the other hand, we will find that also our world is suffer from a lot of problems, including poverty and health inequality. And taking all these factors into considerations and the factors that are out of the health sectors, I'd like to ask these questions, and we may discuss this question at the end of this webinar. How prepared do you feel our graduates are to tackle this complex challenge, considering all these factors outside the health? And this also important question, why now? Why now we should talk and we should pay more attention about the social determinant of health? We should pay more attention about such social determinant of health because of the ethical responsibility for us as healthcare practitioners and align with this ethics. because of the social accountability, which basically defined by aligning the education, research, and community service toward addressing the health needs, toward addressing the community needs that our medical school and health science school serve. Nowadays, many of the accreditation system start to encouraging and advocating the adoption of the social determinant of health across the curricula. Moreover, there is a aspect from student demand, and now we have millennial generation and generation the students. They are type of generations who are seeking the purpose on the social impact in their career. And also, and this was very obvious after COVID-19, there is the global health challenge, including the pandemics, COVID-19, and new species of viruses, and so on. There is also climate change, and this has very direct relation to the health. The concept of health of patient-centered care. So there is the necessity for empathy and understanding of patient background, and also the concept of One Health, which is defined as a collaborative, multi-sector, and transdisciplinary approach that recognize that health of people is closely connected to the health of animal and the shared environment, and so on. So all these are taking this into considerations are considered as important driving factors for thinking critically about the social determinant of health. So how can the curriculum developer and the program developer think about integrating social determinant of health across the curriculum? And as you know, adopting an integrated curriculum will give an opportunity and good opportunity for integrating social determinants of health across the curriculum by revisiting these important topics and aspects across the curriculum in a different way, such as spiral integrations, as we can see here, across the years of the curriculum from year 1 to year 5, or we can do integration at horizontal level as themes in course per semester or per term, as this can be seen here in the right side of the now we'd like to share the good practices about integrating the social determinant of health across the different countries and different experience. One of these good practice is adoption of the service learning. And service learning is defined as providing the opportunity for our students to learn while providing service to the community. The other approach that can be adopted is fostering and adopting of the community-based education. And community-based education is defined as giving the opportunity and giving the providing learning in the community setting. The other approach that has been found to support the integration of the social determinant of health is the application of interprofessional education and interprofessional practice, where we can bring two students from different professions, maybe two or more, where they can interact, they can collaborate, they can communicate and learn from each other. Case-based learning also provides good opportunity by providing cases in which we can integrate the social determinant of health issue, and students can discuss these issues together. Adoption of simulation-based learning also could be a good opportunity along with the interprofessional educations by providing simulated patients or simulated high fidelity simulation in which students can learn these issues. And also one of the good practices of integrating the social determinant of health is through the integrated longitudinal integrated clerkship, which has been widely used in many medical schools and health science schools across the world. And besides this, there are other approaches that can be used as reported in this scoping review. So now let us see together some case studies in different medical school across the globe where they adopt the integration of social determinant of health. And I have brought this case study from this Emmy guide that we have published 2 years ago. One of the schools that adopt the integration of the social determinant of health from the United States is the University of California, San Francisco, and they are adopting 3 years longitudinal curriculum. And their practice that in year one, the goal of the social determinant of health curriculum is to understand how individual and community problems interrelated. Then in year two, the focus is on how community stakeholder approach a problem. And in year three of the program, the emphasis is on the formation of partnerships and intervention, including skills training on the development of logic model, sustainability, and accurate communication skills. This one of the experience that really it was to be studied from the United States. From the United Kingdom, the University College London Medical School, they are using flipped classroom learning to include understanding the size of health inequality in the United Kingdom, describing why health inequality exists, then description of the causes of the cause, root cause analysis, healthcare model, and description of life course concepts. They are using simulated patient tutorial, where students are tasked to analyze the role of every health professional, the application of the knowledge of health inequality, enhance skills in taking history, in social history, and understanding the most appropriate intervention at individual, local, and national level. These outcomes are achieved through investigation using the public health outcome framework, interactive presentation, YouTube videos, TED Talk, diagrams, written explanation, quizzes applying recommendation to real live public health initiative, group social history taken from simulated patient, student reflection on the reason for taking history, and brainstorming session with the students. This also good experience from University College London Medical School. The University of Toronto, Canada, also they have a good example of integrating social determinant of health, where in the first year, students are oriented to the concept of service learning and social determinant of health. And at the end of the first year of the training, community organizations are introduced to the students by their tutor. And at the start of the second year, tutorial groups and tutor visit their community partner site for a tutorial session, which serve as orientation session. In subsequent field visit, students focus on learning about the community and community partners, paying a particular attention to addressing challenge and discussing people solutions. And in this field experience, students participate, observe, contribute, and learn about advocacy. Following these field visits are punctuated with small group tutorial sessions, which offer opportunity for reflection as well as debate and discussion of major themes and topics connected to community engaged learning. And at the end of the year, student, community partners, faculty, and administrators attend a community forum where students prepare a poster presentation to share their experience with community partners, faculty, and peers. So this is a good example of activities and approach to integrate social determinant of health. Another example from the region, from Sudan, University of Jazeera, they are using interdisciplinary field training and research at the Faculty of Medicine. And during this course, a small group of students from different faculty are assigned to various village. And in the first phase of this program, students identify health problems and their socio-cultural determinants using various investigation tools, including questionnaires, interviews, observations, and qualitative methods, such as focus group discussion. During the second phase of this program, which is considered as the implementation phase, in which the students executed a project through full community participation to solve one of the priority problems identified in phase one. And usually these problems is not problems related to the health, but it is one of the problems that outside the health sector affecting the health. In the last phase, phase three, students study to what extent these measures implemented in previous phase and in the previous phase have been successful, and there is evidence that the integration of social determinant of health in this course was well implemented. Another example also from USA is Rutgers, New Jersey Medical School. They have integrated the social determinant of health in emergency medicine clerkship. It is a 4-week clerkship, and students used to conduct interview with patients to identify social determinant of health factors influencing their health and care. And then students submitted a written reflection based on the insight gathered during the patient interview. A small students group selected specific patient cases to study in detail, and groups researched the social determinant of health impact on their selected cases and collaboratively develop strategies to address the identified issues. Team presented their finding and proposed strategies to peers, faculty for discussion and feedback, and students were evaluated based on their written reflection and oral presentation. So all these 5 case scenarios identified, explored some international and experience from the region about the integrating social determinant of health across the curriculum. And the preface this last experience from New Jersey Medical School is very well reported in Medit portal, this article about social determinant of health curriculum integrated into emergency medicine. And in the left side, they provide us with a very useful material that we can use and that we can adapt and adopt with some adaptation considering the context. So studies and literature identified a lot of benefits if we integrate social determinant of health into our curriculum. And this benefit is include, but not limited to, augment our medical schools with the skills, knowledge, and attitude and passion to practice health patient care delivery. And it helps students to create awareness, among physicians of the effect of social and legal issues in health. And it helped to engage residents and physicians with patients, considering the broad aspect of health. And also, it was found that it assists patients with health concern not require medical care, and it improves patient health at both individual and community level, encourage interprofessional education, which is highly needed and multidisciplinary involved, and it will help us to graduate socially and culturally sensitive physician. The important question here, what to be included in the curriculum from this social determinant of health? There are some study in which the researcher try to establish consensus on inclusion of the social determinant of health in undergraduate curriculum, like this study, and they came with a list of topics that need to be addressed in the curriculum. The key message here, it is not one size does not fit all. And when we talk about curriculum and curriculum development, the context is very important. And we are medical educators from the region. We need to do a similar exercise, identify and rating what are the most important topic related to the social determinant of health that they are affecting the health of our community. And accordingly, we can think about how to integrate these aspects into our curriculum. This also has been reported from the literature about what should be included at the knowledge, skills, and attitude domain for social determinant of health across the curriculum. Definitely, while we think about integrating social determinant of health curriculum, we will face a challenge. And this challenge could be related to time constraint or maybe related to faculty or related to the students. Time constraints related to we have a short period of time in delivering a curriculum. For this reason, we need to revisit our curricula and to think about how we can do such integration. And factors related to faculty limitations could be either related to a lack of expertise from one aspects or lack of interest also in integrating social determinant of health. Study also show that students may resist such topics because of their perception that this is a non-clinical or less important topic than, and we need to do for that. There is definitely solution to overcome this challenge, and one of the solutions is to identify any overlap and integration opportunity in the curriculum, and to revisit our the curricular content and to think about what are the core competencies that should be addressed at the end of the curriculum rather than looking at the curriculum from content and coverage aspects. Faculty development is the key for any innovation in the curriculum, and faculty development to raise the awareness of the faculty related to the social determinant of health principles, the innovative teaching and learning approach, the cultural aspects, and also considering having like champion for social determinant of health. Involvement of the students in this change is very important for having this change, and this include the peer lead initiative promoting social determinant of health, senior student guide juniors, and having some initiative using gamifications and other important engagement methods. The final slides related to this is how we can do this integration step by step, and this is a step-by-step guide for doing this such integrations. It is very important to think about when we'd like to introduce any change. We need to think about the positive change management approach, and appreciative inquiry is one of the recommended approach that we need to follow in order to lead this change. And we can follow this 5 model appreciative inquiry. The first step related to the definition, and the objective at this level is to establish clear positive goal, and the goal here could be to integrate teaching, integrating social determinant of health into our curriculum. And the question could be, what does success look like when social determinant of health is fully integrated into our curriculum? Then we will move to the second step of appreciative inquiry, where we identify what is already working well in our curriculum and what is already known by our faculty. An example of that is to explore the current educational activities or initiative that we are using across the curriculum, such as community-oriented medical education, surface learning, research-based learning, and so on. And the questions could be here, what are we currently doing that raise awareness of social accountability? And where have we seen success in students engaging with the social determinant of health concept? The third level is the third step is a dream, and dream is related to what might be and what the word calling for. And here at this stage, we can envision what the future would like if social determinant of health were effectively integrated in all aspects of training. An example here is to imagine our medical or health science school where students are not only taught about social determinants of health, but are immersed in experiences that allow them to address these issues in real time, such as through partnership and community organizations. And the questions here could be, what would it like if every student left our program with a deep understanding of social determinant of health, and what are the implications of this on our healthcare system, and what change if doctor considered patient social conditions as part of care. Then we will move to the design, and the design is related to what should be the ideal. It's about co-constructing, and the objective here is to co-create systems and strategies that will allow the vision from dream state to real life. An example here is to collaborate with the curriculum committees, with faculty, with community, with the stakeholder to design new module or new courses or workshops even at faculty level. And this could include case studies, simulation, and so on. And the questions here, what new education experience should we design to teach social determinant of health, or how we can embed this experience in existing course or rotations. The final stake is the destiny, and here it's related to how to empower, learn, and adjust or improve. And here we are sustaining this change. And the objective here is to implement and sustain change, ensuring they are institutionalized and become part of the culture. An example here is to roll out the new curriculum change with regular feedback mechanism from students, from faculty, and from stakeholders. And the question will be here, how will we monitor the impact of social determinant of health integration on student learning, and how we can create a sustainable model that will evolve as social determinant of health challenge change. The most important thing about this appreciative inquiry model, it it will reduce any possible resistance from the faculty or students, because it is already built on the positive aspect that we have across the curriculum. How to do at planning phase, we have to ensure commitment from all stakeholder. We have to create an active leading group in our colleagues. Very important to conduct a rapid need assessment, and then to revisit the program's learning outcomes based on the competency framework that are available. At the implementation phase and curriculum delivery stage, we need to think about the mode of integration. Will it be vertical, horizontal, spiral, and we need to identify the content, like the study that has been made by expert consensus. Very important to create working group, and simultaneously we need to consider faculty development. When it comes to the assessment, curriculum mapping is very important, and we need to align and map the curriculum to ensure that social determinant of health objectives are covered comprehensively across all phases of the curriculum. And we need to think about which assessment instrument that we can use to effectively measure this. And finally, for the program evaluation, we need to adopt framework for comprehensive program evaluations, and we need to promote further research and to advocate the integration of the social determinant of health. It's very important to consider multimodal assessment strategies beyond the traditional exams that we have, like the use of the concept map or open book exam, using the objective structured social examinations, which is some modification of the OSCE, and also reflective. Where here we have simulated encounters for focusing on the social issue. Very important to consider reflective practice and journaling from the students, like digital journaling, activating the portfolio review. It's very important to engage community and to have evaluation from the community, as we see in the case studies from the University of South of California and UCL, University College of London. And it's very important to have innovative tools, such now with the era of the AI, we can use it for this. So what is the impact? So when we adopt the social determinant of health across the curriculum or medical schools, uh, it helps in the growth of our students, and there is a community benefit. This will support us to have a competency development, and we can align this with like the competency framework that we have in the region, like Saudi Med, Emirati Med, and the other competency framework. Also, it support students to rethink about their career choices, and this will increase the interest in primary health care, public health, and serving the underserved community. And studies show that there is a huge gap in the specialization of this important specialty, such as the public health, primary health care, and the general practitioners. Um, and also, there is a community benefit which related to the health improvement, and this will affect positively the health system. It will reduce the emergency visit, and it is very useful for the chronic disease management. And according to the recent study conducted in the region, show that the burden of non-communicable disease affect the six GCC country with around 50 billion per year. So, uh, uh, providing the opportunity for our students to know about this social important aspect in the curriculum, social determinant of health, it will not have impact only in their personal and student growth. It will also benefit the community and benefit the health system and the economy also. And also it is very important for the empowerment, community actively participation in health solutions. Also, it has institutional advantage, which is related to the reputations of enhancing the reputation of the university, and then also research opportunity and social impact. Graduates will advocate for health, for systematic change, and they will have a contribution to international health equity and effort. So now I come to the end of slides, and I'm looking forward to continue discussion by this. Not only the questions that we need to discuss, we need to discuss deeply this important topic about what innovative strategies that we can use to consider integrating social determinant of health in our medical schools and health sciences school within the region, and how can we support each other in overcoming some of these common challenges. Thank you so much again for the Saudi Medical Education Society for giving me the opportunity to discuss this important issue, and looking forward for having a fruitful discussion.
Yeah, thank you so much, Dr. Hassan, for this wonderful presentation, the way you have taken us through the journey that how social determinants of health are important to be part of curriculum. And I know that there are a lot of challenges, faculty development, including perception, curriculum itself. So I hope that our participants, they really enjoyed this talk. I can see a few of the comments in chat box as well. And Dr. Taha, I think you can also have access to them. I shall really appreciate for the participants, you can raise your hand. I will allow you to unmute and you can ask your question. I can see that there is one hand raised by Saud. So yes, Saud, go ahead.
Hello, everyone. Thank you so much for your great presentation and the great topic. I am Suad Tahir Ahmed from Sudan. I am a community physician teaching in Faculty of Medicine, Omdurman Islamic University. This is a very important topic, integrating social determinants of health in medical education, and we already started in our faculty. I can briefly talk about the experience. We have this integrated curriculum. The role of integrating the social determinants of health is part of the community medicine department job. So we start our teaching from the start, from the beginning. The courses which the student begin is not that pure clinical or basic science. We start with the brief or introduction about the professionalism, introduction about the basics of epidemiology and biostatistics, the concepts of primary health care and social determinants of health, even the concept of health economics and health services is injected is as a basic concept in the minds of the students from the start, from the first year. Then when they come to have this basic science, the integrated system allow us to, for example, if they study cardiovascular system, we have to inject also the relevant health problems, especially that dominating or have a high magnitude in Sudan, for example. And then we have also the chance of having this curriculum block courses not integrated in the other system. Block courses for research methodology. We encourage the student to have the researches. This is for the second year. In the second year, they make researches relevant to the community. For example, in the event of war, we have online, we have conducted the course online. I will give example for the topics that was chosen by the student. For example, students in Undurman, they are talking about stray animals, which is a phenomena appear after the war. And also they have chosen the title self-medication because of the corruption in the health system. This is as a brief example about that the students is feeling what is important to the community because they already exposed to these concepts from the beginning of their medical education. And Dr. Muhammad Ahmed or Dr. Muhammad have given me the idea of maybe writing a case study for our faculty. Thank you so much.
So it was comment and a lot of compliment.
Yeah. So may I add, just thank you so much, Dr. Suad, for, I will be brief, Dr. Shazia, for sharing these comments and sharing the experience. I'd like to comment on one aspect. It's very important to have a leader in the college for integrating social determinant of health. However, it is very important to have a full plan that this integration should not be solely a responsibility of one department, because if this be part of the family medicine or community medicine department, this will give a message that this is the community medicine, it is a responsibility of certain department. So integration should be across the curriculum and should take place in all courses across the curriculum. However, again, it is very good to have a leader for this integration, but it should be across the curriculum and it should be seen like the experience that we share from University of New Jersey, USA. The integration is done by the clerkship of emergency medicine. So the key message here, it should be integrated in all aspects of the curriculum.
Yeah, thank you very much. I hope that answered to your question. I can see that Dr. Kamran Sitar, he has written some questions in chat. First of all, he is thanking you for this wonderful presentation, but he wanted you to elaborate more on assessment. Do you prefer formative or summative assessment if we integrate social determinants into our current curriculum, especially in Saudi Arabia context for undergraduate medical education?
Yeah. So I'd like to start with the last thing, context is very important. For this reason, when we explore the experience of the study that made in USA regarding it's very important to consider the context about the countries and about the region. Both are needed. Formative and summative assessment are needed because formative assessment can give us students more opportunities so that they can receive feedback from their performance on the understanding of social determinants of health from the different stakeholders, including the faculty, their peers, and the community. And at the same time, and as you know, assessment drive learning. So having some weight for the summative assessment will be good, but uh, giving more weight for formative assessment would be much better so that we can give more time for the students to learn and to enhance their learning while integrating these important concepts.
Great. Thank you. Same kind of questions are in Q&A box by Dr. Hamza Muhammad. That is there any example at Saudi universities that used social determinants of health, and how can we implement in our curriculum in Arab region?
An example from I'd like to reflect on my experience. I has been working in Qasim University for 5 years, and I can remember very well the curriculum of Qasim. And in the curriculum, they are the aspects related to social determinants of health are delivered across the curriculum with emphasis on the first 3 years of the program, where students are attached to primary healthcare center and learn around these important concepts. So I think many of Saudi medical schools they have they have done very well in this integration. Again, looking at the Saudi Med competency framework and looking at the core competence of the Saudi Meds, we find that one of the core competence of the Saudi Meds is related to the community and serving the community. So I think at planning level, there are good effort that made to integrate social determinants of health. Maybe some of the colleagues need to exert effort in moving forward with this important concepts and skills.
Yeah, thank you. So there are more thanks in our chat box. I can see that yes, Savannah, you can talk now. I can see your hand raised. So
Can I speak?
yes,
Yes,
please.
please.
Thank you. Congratulations, first of all, Dr. Muhammad Hussain, for this wonderful talk. I am Shivan, independent researcher, social determinants of health in India, a former medical school faculty. When I was teaching, there was no prescribed format to teach social determinants of health or behavioral and social sciences. In fact, it was not taken very seriously, and less time slots allotted to teach. I experimented something new. I used to teach behavioral and social sciences by repacking them under the umbrella heading social determinants of health. And the issue of availability of trained hands to teach social determinants of health or behavioral and social sciences is very important. Either medical graduates or social scientists are teaching. Very few places social scientists are engaged, as it happened in where I used to teach. But the problem is that if they are medical graduates, they are products of deficient curriculum, so SDH curriculum. If it is social scientists, they are not trained to teach in the medical school setting. So either way, it is affected. So there should be a concrete effort to streamline teaching medical social determinants of health in medical schools. I think the things have started changing in India with the advent of the CBMA curriculum. Thank you.
Thank you so much.
Yeah. That's really very great information that people, they are very much keen to introduce social determinants of health within curriculum and thinking it seriously. Um, yes, please. There was one more hand raised by Muhammad Salinami. You can talk now.
Can I talk now?
Yes.
Yes. Good evening, everyone. Thank you, Dr. Muhammad Taha. Thank you, Dr. Shazia, for this great work you are doing. And really, I enjoyed listening to this presentation about social determinants. And it sounds that it is mostly related to curriculum design. When you want to design a curriculum, correct me if I'm not wrong, you should design it according to the social determinants. Am I right?
When you design a curriculum, when you review a curriculum, when you update the curriculum. Yeah.
Excellent. So now most of our medical schools are already following certain curricula that have been copied and pasted through many years, through dozens of years. So how can we change in that case?
Yeah. Thanks so much, Dr. Muhammad. And there are several change management models that can be used to manage the change. For this reason, I have chosen the appreciative inquiry models, where it's basically based on acknowledging the positive and the strengths of our existing curricula. So first of all, we need to have a plan. We need to have a strong leadership commitment toward addressing this issue. And we need to have strong involvement of the stakeholders. Those are from the health system and the accreditation body, so that we can support us to move with this. So appreciative inquiry model is highly recommended in such case to mitigate any resistance and to avoid any resistance. We cannot say to avoid, let's say to reduce any potential resistance that may take place. And many medical schools now are reviewing their curriculum to consider these important aspects.
Yeah, very much valuable.
Thank you. Thank you.
Thank
You are
you.
welcome.
Yes, Dr. Mona. Yes, Dr. Mona, you can ask your question.
Assalamu alaikum. Thank you for this excellent topic, which is a hot topic these days. And I just want to share with you our experience when we were asked by the NCAA to create the key learning outcomes for the medical school. We wanted actually, and we consulted an external consultant. How do we explicitly represent the social accountability and social determinants of health in the program learning outcomes or key learning outcomes of the medical curriculum? I found it, should we put it considered under knowledge, under skills, or under value? I know it's a broad concept, it's a theme, but if we are designing a curriculum, then the program learning outcomes will be the framework under which the courses will be built and everything else will follow. So do you have any guidance towards that?
Yes. Actually, in the literature, there is some framework from. Thank you so much, Dr. Mona Sheikh, for joining us in this webinars and for sharing the comments as well as the questions. There are some literature that provide a category of the how learning outcomes could be integrated in this three area. We have published AMI guide about integration of the social determinants of health, and this has been also listed in the AMI guide. So I will share a link of the AMI guide in the chat so that we can. It is available in this AMI guide. It is extracted from the literature, and also it is recommended by the WHO.
Great. So I can see that there are no more questions. If anyone can have more questions, you can please raise your hand because we are approaching towards the end of our time. Dr. Taha, I have one question, as I was very much keen when I saw your last slide and you mentioned two questions, that what is role of innovation in upbringing social determinants of health, and as I'm very much proponent for role of artificial intelligence and we are living in this era. So what do you
Yeah.
think that how AI will influence social determinant of health or in other way?
These are actually difficult questions.
I'm sorry for
I'm
that.
not, no. I'm expecting you, actually, Dr. Shazia, I was expecting to asking you these questions because I know your expertise in the AI. But I will share something here. Recently, I was in a discussion with one of our colleagues from the College of Computer Science about how we can integrate our using AI in doing like prediction of the situation of the medical and health science school if they adopt such strategies. And I think this basically depends on the data that we have. So and well documented previous experience, then maybe machine learning and data analytics can support the colleagues so that they can see their simulation modelings or future direction for this. I think this area of research, and we need really to think about how we can use this advancement in medical education and health professional educations in supporting the integration of such this issue. And inshallah, we will work on that bismillah ta'ala, inshallah.
Yeah. Thank you so much. I'm really very much keen, especially once we talk about generative AI, it can really help us to identify what are the weak areas
Yeah,
in the curriculum and which units we can embed more. And it can probably
exactly.
fix our curriculum about determining program learning outcome, as well as Dr. Mona asked the question. I'm very
Yeah.
much happy that Dr. Nihal Khamis joined us today, and probably she could be the best answer to add something to answer this question. Yes, Dr. Yes, Dr. Nihal, go ahead.
Assalamu alaikum. Thank you very much, Professor Muhammad, for this excellent presentation, and thanks, Jazia, for the, as always, excellent moderation. So regarding how can we use generative AI or AI when it comes to the integration of the social determinants of health, this can come at multiple levels. To start with, this can, of course, be a very helpful tool when it comes to the curriculum design and the curriculum mapping to see where are we tackling the learning outcomes relevant to the social determinants of health. For the curriculum design, actually, if I might share our experience at Hopkins, because I'm mentoring in our curriculum development course, clinician educators building their curricula. So we have engineered customizable prompts for each of the steps for curriculum development, and it's working, and it helps to have a type of technically sound assistance to the curriculum developers. It applies to the social determinants of health. One important use is relevant to our transition to the concept of precision medical education. So there is a good chance that we have the capability to collect big data and analyze them into insights about what might be the personalized learning needs for our students. And as such, for instance, some of the medical schools here in the States starting using some mock EPIC electronic medical records for the training of the students. So we can look at if they are integrating the social determinants of health or not in history taking, for instance, considering it in the management, etc. We can collect real-time data from this and from other sources of evaluation, and then we can have insight about how our students are doing and how we can improve this. Regarding program evaluation, generative AI and AI in general is having a huge role, of course, and there are many uses for this. We have also engineered a set of generative AI prompts for the 6 steps for program evaluation. And this can be used by medical educators at the medical schools, even though the schools which does not have extensive artificial intelligence, large machine learning models, they can use it just with the available generative AI chatbots. So to conclude, curriculum design, curriculum mapping, learner assessment, simulation scenarios, and the evaluation, the use of big data, and getting a precision medical education into operation. Thank you.
Thank you so much, Dr. Nihal. And thank you so much for connecting in this webinar.
Thank you so much, Dr. Nihal, for a wonderful explanation. And probably, I think we can have separate webinar on role of generative AI and curriculum mapping. That would be interesting. Yeah. So there are a lot of thanks and appreciation for your talk, Dr. Hassan. Thank you so much sharing one of the publication, and many congratulations. We just saw on LinkedIn that you have published one of another article at BMC Medical Education Journal. Many congratulations, and we will
Thank you.
hear more about that. I shall appreciate if you can share link to that article here in chat box for our audience, and that website as well.
That published today?
Yeah.
Okay, I will.
Yeah. So with this, I would say thank you to all participants for joining us today. And I would like to make an announcement that Saudi Society is having medical education conference at Jazan University. I have already shared brochure in our chat box, so you can please note the dates. It's on 4th to 5th December, and it will be really good chance for all of us to gather over there and see each other face to face and to discuss more about these kind of topics. So thank you so much, Dr. Taha, and thank you all participants. Have a wonderful day. Bye-bye.
Thank you so much. Thank you so much. Assalamu alaikum.
Walaikum assalam. Take care.
Thank
Bye.
you so much.